John McGuinness.
Corda, I just want to place on record my own disappointment that these services are not appropriately staffed with the qualified people that are necessary to deal with the numbers that are turning up for the services. I've seen that at first hand in Kilkenny. And you can take the psychiatric services generally and see that there are patients there that are inappropriately placed because there's no place else to go. I've seen the centre in Kilkenny City, which caters for a number of counties in the southeast, being overwhelmed by the numbers that turn up for care. And when you have someone in this situation that requires treatment, that requires counselling, that requires supports, and you put them on a waiting list, it just doesn't work for them. It's something that's required in real time, and it's not happening for them. So when you go down along then into the community services and indeed beyond, you find that there's a number of agencies, some directly from the HSE, some funded by the HSE, that are cobbling together hours of care for patients that need 24/7 care, or for children that are having difficulty with mental health issues. And that isn't good enough. It might be fine on paper, the plan might look okay, but I've attended so many meetings with parents with the HSE about their child, or indeed in some cases children, and I'm always taken back by the fact that those on the front line are making every effort, but the plans that they're putting in place are unrealistic. The range of services that are required are not there, and I'm inclined to believe that like those in general, the nurses in general hospitals, the nurses in psychiatric hospitals, or the DOP in my own area, they're under so much pressure that it's not an attractive position anymore. And they could cope with their own workload, but it's the fact that they're trying to respond to a demand from individuals and families that they cannot just meet. They don't have the professional capacity to deal with it. And it is desperate to see families struggle in circumstances like this, and the port of call, the HSE or the professionals, are simply not there. Now, something has to be done to arrange appropriate care and to fund it. And I think the only way to deal with it is in the context of acknowledging that there is a problem in the workplace for those that are qualified. And then there's a problem of undercapacity in terms of the qualified people that are necessary to deal with these issues. In Kilkenny alone, on one weekend, there was 3 suicides. Another funeral today of a young man, and again, died by suicide. And all that can be traced back to their younger years and the fact that they were neglected in some way as they went along through the services. Some fell through the cracks, some just did not get the service that was required, and that's an awful reflection on the HSE and on the management system within the HSE that does not deliver. Now, the community model of decongregation in some cases and the community homes, they're all affected by this. They don't have the numbers to deal with the cases that they have, the number of professionals to deal with the cases that they have. And as a result of that, the individual suffering from mental health issues is actually getting worse. So they'll carry, if it's not treated, if it's not looked after, if they're not looked after, they just carry it on to the next phase of development of that issue, and it becomes deeper and more difficult to deal with. So if we're making these representations to the HSE and drawing these cases to their attention, you would imagine that they would see for themselves the pressure that the staff are under, the necessity to get the professionals in to make the job better, and then to have a concentrated attempt to deliver the services to the doorstep of the person if necessary. But in an awful lot of cases, Minister, that I have seen, in some cases inappropriately placed, as I said, in the DOP in Kilkenny. They turn up for services, they're left in chairs and beds on the corridor. They're literally sitting in a chair waiting to be admitted. In fact, in 2 cases, while the person was waiting to be admitted, they left the services and others had to be called in on a search and rescue mission for them. That just isn't good enough. And again, I say to you, the type of services that are required to deal with this need to be put in place, but they need to be available on demand. Unfortunately, that's the way it is with mental health. So please, can you confirm the funding and how this issue is going to be addressed?
Minister, if you